Hello. Hello, Louise. It's an honor to have you on Real Medicine Talks, and thank you for being willing to come and to have this conversation. And I would like to just share with the people who are watching that Louise is really a visionary healer and very much a groundbreaker in bringing medicines together. And so it's a real pleasure to have you and your family medicine, but your energy medicine and also your great visionary gifts. And so what an honor to have you here and to be with us. Thank you.
Thank you for asking me to be on. It's my privilege. Thank you.
So much. And so, Louise, I like to start with this question about real medicine and what is real medicine to you? I really see medicine as the word for like moving toward wholeness, healing. And so I would just be interested to hear about what real medicine is for you.
For me, medicine is a combination of mind, body, spirit. And when you combine all of it, I think we get the best form of therapy possible, because we can't separate mind, body, emotions, spirit. When you move one, all of it moves. And so for me, if you listen to the physical ailments, you examine, you assess what's going on, not only physically, but emotionally and mentally. So you see the whole person. That is definitely the best way to approach any patient, I think, for anything they've come in with, because everybody comes in maybe with a different situation. They may have a small lump, which is a physical condition, but all the other attachments, is it cancer? Is it not cancer? What does it mean? Does it affect my family? So it's not just a simple physical aspect. So it's the whole patient that's really important.
That's really powerful. And it makes me think about in the soul care work, like we have the holy privilege of working at the same clinic, which is really fun. Village medicine. And in my soul care program, something that I notice, like when people come in with a cancer or I had one woman who was, really struggling with her blood and what was happening with her blood. And, people always seem to know, well, what I usually do is I ask them first, like, what is the rupture? Like, do you know what the rupture was that caused the cancer or that caused the hemorrhage or that caused the leukemia or that what is it specifically? And people always know, Louise, they always know. They know exactly the moment. They know, and they can tell me their age. And so I've seen a lot of evidence of this in the soul repair. And so that's really powerful.
The interesting thing about that is, yes, one definitely sees it. Somebody who's had a problem expressing themselves their whole lives often develop thyroid cancer, or people who've got emotional issues where they never felt good enough and they always had to be a certain way may develop breast cancer. But the patient has to work that out themselves, because otherwise they think, I caused this by myself, so it's my fault I have the cancer. So I think that's really difficult. And then also, of course, you have these pediatric patients, less than a year, having cancers that are, life-threatening. So there is definitely one way where you see a disease process and you understand the emotional patterning. But as a doctor, I feel that I don't have the right to tell people that, because it it would make them feel too much responsible for causing the disease.
Yeah.
So it's a matter of people. What I've also discovered is some patients with cancer is they've started to look and they go, aha. So it's a self-discovery as to what happens. But also there's the environment, there's the toxins, there's genetics. It's a multifactorial problem.
Very, very much, very much. Well, Louise, what that brought to mind was just how illness is a mystery. I think illness is such a mystery, and I think we don't always know, like, if there's a why or what the why is, but I do notice that I think a friend of mine said 1-800 dial God, like cancer is actually 1-800 dial your higher power, like, oh, if you haven't called before, you'll call now, but I also, the other factors are, it's something that I wanted to ask you about was also about being a woman in medicine and coming in, in Africa. You graduated from Cape Town, and what was that like in that time?
In an interesting journey. I graduated a number of years ago. I've been qualified 48 years now. And I've had the privilege of working in 4 different countries and different states. And when we first started at medical school, there were 150 people, and we were probably maybe 10 women. So we used our female wiles. We knew that if you were, it would help you in exams, and you knew you were different because you were a woman. But when it came to patients didn't seem to have that distinction. They just wanted somebody to care for them. And having worked in different countries and seeing the way different people treat women in medicine, in America, I think now they qualify more women than men. I think it also depends on your specialty. I know some surgeons who are women who make comments they're not treated the same as men because it's a man's profession to, say, do orthopedics or plastic surgery. And so they find it different. So being a woman in medicine, I feel very privileged that I have been, because we come with a slightly different viewpoint. Being a woman, you understand a lot about women, and so have a bigger understanding. So the difference between men and women in medicine, I think it's probably the same. But to me, being a woman in medicine, I've always felt very privileged that I'm a woman, because you have just a different approach. And the treatment, it also depends on who the doctors are you work with. If they come from certain countries, being a woman is you're not kind of treated equally. You're definitely lower. And in others, they are absolutely equal. So it's very variable. And I also think it's the way one approaches it, because you have to understand where the other person's coming from, and just being who you are and practicing the best medicine you can. There's no distinction between a man and a woman.
That's lovely. That's lovely. And we also now have some non-binary doctors that are doing such beautiful things, and
yes, I think the non-binary population are very appreciative of docs who are like that and understand on a level that maybe others can't. So I think it's wonderful, because often like looks for like in care.
yes, yeah, it feels good to be touched by someone who can actually be touched by you
Yeah.
in
Yes.
in a different way. That's lovely. I was wondering, Louise, about with your journey with medicine, when did you begin your journey with energetic medicine and looking at energy as healing?
I think as a little girl, I used to see colors around people, and it was glorious. But my mother told me there's no such thing, so I stopped seeing them. And then when I became a doctor, I'd never had a burning desire to be a doctor. My father said I should do medicine, and I loved my father, so I did it. And very soon on, I realized you have to touch the patient. I didn't know why. You just had to touch them, not only examining them, but you would just put your hand on their shoulder, and found that that somehow had an incredible effect. And then we moved to America. And because I couldn't get a license, because I didn't have a green card for the first year, because my husband was the one who got the visa to come, I arrived in America and for some reason looked up spiritual healer in the yellow pages. And I found this amazing woman. She was a Reverend Button. She was the most extraordinary woman. And I called her up and I went to see her. And she said, why don't you come and join my classes on a Monday? And she said, we do energy healing. And I really went with a completely open mind, not understanding anything. And I walked in there. And when you arrive somewhere and you feel at home, you've never been there before. And people were sitting on chairs and they were waving hands around. And I just had this incredible burning desire to experience that. And it was amazing what one could pick up. And so I do believe everybody has the ability to pick up things, to be able to be sensitive. But it's obviously a matter of whether people are interested or not. So this Reverend Button taught me an enormous amount. And then it actually started before with somebody called Dolores Krieger, who was a nurse from the States. She worked in the 1980s. And she came to South Africa and did a workshop for doctors. And we all did energy stuff. And she would say, see that person over there, close your eyes and see what's wrong with them. So that was very fascinating. So my interest has always been there in being able to be here and being able to explore and see all what is available and get rid of the fear of not being an ordinary doctor and the concern one has about one's colleagues. What will they say and all that. That fortunately the world has changed. So people, and also with all the research with the Dalai Lama and Richard Davidson, it's a different world. So it's much more accepted. But also because it feels so amazing to be able to tap in and assist patients, it's the most rewarding thing to allow somebody to explore their own journey and heal themselves. Because that's what I feel. I'm not doing the work. The patient is doing the work. I'm giving you a seed. You're planting the seed, you're watering it, you're tending it. So it's the patient who does the work. So they do the healing.
It's really, I had healing with you just the other day, which was amazing and really powerful. And I think that there's just something, you were talking about sensitivity and just the profound love and sensitivity to be able to bring something like that through. And I think that we've really been desensitized and kind of subjected to so much that is really meant to help us not feel.
Mm-hmm.
But feeling that intuitive nature that you're talking about is, I mean, that nature is an essential aspect of what we need in order to connect, to be together, to really to heal the world. Because I think we're, seeing some evidence of what not feeling is.
Absolutely, absolutely. Yeah, it is. I think that everybody has got this wonderful higher self within inside of them. And many times you tell the person and they kind of look at you like this and go, uh-huh. They know. I think everybody knows. But somehow our society, we're living in a very challenging world with fast, produce. People are in a survival mode and they put that higher self or that higher part of them that could give them an extraordinary sense of being and who they are. They hide it or they forget it's there. And so if people could reconnect with that beautiful higher power that's all knowing, I think there would be a lot more healing.
So kind of like their own divinity, like
Yes.
that knowledge of their own divinity. And that's, what kind of changes do you think are needed at this time? I mean, I look at medicine and this is a conversation my partner and I have about the face of medicine, and what kind of changes do you feel are needed, or what are some changes we might make or could make?
That's a very difficult question, because the way that I've seen medicine develop is, on one side, is wonderful because you've got super specialists who do minutiae and do amazing work. The other side is, I've heard patients say, oh, nobody's examined me for the last X number of years. And I find that, having trained in a medical school where it was take the history, and if you don't have a diagnosis, take the history again, then you examine intensively. And then if you still don't know, you do special investigations. So my training was very different to what I'm seeing here. And I understand it's a lot of finances, a lot of patients, a lot of doctors are feeling pushed because the hospital says you need to see X number of patients in X number of hours. So there's a lot of pressure to do that, because a lot of the bottom line seems to be financial. And it's really hard for a lot of people who want to maintain their practices outside, because the expenses become outrageous. The insurance companies make it more and more difficult for people. So it's really interesting on the one side to see the amazing developments and the super specialization. But on the other side, I see a lot of people falling by the wayside, and people forget they have to be their own advocate.
Oh, yeah.
Which is really, really important, to stand up for what you believe and not just take on what somebody says.
Yeah, that is true.
So it's a very difficult, when you talk to people who, like in the UK or Canada or Australia, where they've got like national health, it works really well on one side, but then there are a lot of complaints on the others. They have to wait a year for a hip replacement, or it's just, there are pros and cons of everything. So an ideal medical system, I think, is really very challenging. But the way that I see it, if people could spend a little more time with their patients, examine them and listen, There's a statistic about a doctor. Apparently, we listen for 20 seconds and then we talk, which is not a long time for the patient to talk.
I know. Oh my. And yeah. And it's one of the things that I understand is that, and that I see, like, and that I know is that, I mean, I love my patients. I love them, and Carrie and, Tara, like, we love them. And
Yes.
I think that there's like something that has been not recognized or not kept sacred.
Yes. Yes. It is such a privilege for a patient to come to you and trust you to take care of them. And so there's a magical feeling about that. And I think if you had to say that to all doctors, they would all agree that there is something about it's very special when somebody trusts you to come and see you. But the busyness kind of, one is so busy, I think that is not recognized.
And the spaciousness, like I hear you saying that it's almost like that wonderful spaciousness that allows the relationship even to develop isn't encouraged. And
there was an interesting, having worked in practices which were, I think, the busiest I've ever been. I was in South Africa. I saw 60 patients between 8:30 and 1. And I remember feeling that it was very challenging. But one of the things that when you're running a very quick practice is to not think about what's happening outside, I would have the technique, I would knock on the door and say, I'm here. I don't care what's happening over there. So if you take the time, it's interesting how it expands. If you're really listening, that 5 minutes is time, as opposed to hurry, I need to move on in the next 10 minutes or so. So that was an interesting look at time, because we can hurry it or we can slow it down just by being in a specific space. And it's hard to train yourself to do that. It's very hard.
Yeah, it really is. I mean, to not be in the future or in the past, but to really be with
Yes.
who we are, where we are, who we are, doing what we're doing in the moment. Yeah, it's interesting, the word encouragement is not encouraged or supported, or yeah, which is really, really interesting. And so what do you think, what we've been talking about, like sensitivity, feeling, and it feels very much like the ordinary and extraordinary aspects of medicine. And so do you think there's something that people could do right now? We have this pandemic that is happening that has all kinds of new variants that are like daily things. Some people are like choosing to stay home. Some people are out and about. Some people have all different ways of working with it. But I would just like to know your view about that. And also, what are some things that people can maybe do for themselves energetically? And
okay. Yes, this pandemic has been very, very challenging for many people. And also, I have connections with people around the world. And so, we talk about social distancing, we talk about masking, we talk about vaccinations, which are obviously all absolutely essential in my mind. And then I think about where I come from, South Africa, where multi-generations of people live in a room. So how do they social distance? They live day to day. So they don't go to work, they stay at home, they're not going to get food. So there's that side. And And the other side is following the science, which many people are not doing, which is difficult. People are choosing other ways and not being vaccinated when the science is saying be vaccinated. So that's also an issue. So how does one deal with a pandemic? I think masking is very important. I think social distancing, vaccination. People are traveling. People are also very, very tired of this, and people are denying things that are happening. Yes. So I think one needs to have a comfort zone within inside of yourself, what works for you, which is difficult because, people get invited to a wedding and there are 200 people there and they don't want to go, but they feel, well, I should go because everybody else is going. And so my suggestion is do what works for you and stay as safe as you feel comfortable. And so you asked me for some suggestions. There's something, it's an easy thing to remember. Breathe, B-R-E-A-T-H-E. And each letter will stand for something. So B will stand for breath, because it is so important we breathe in and out, because many times we forget to breathe, and that causes a lot of anxiety, because when you're using your diaphragm, it engages the parasympathetic nervous system, which is the relaxation response. So if everybody just remembers to take a few nice deep belly breaths a few times a day, that can cause relaxation. Then the R is for relax. Often we feel tense, everything's tight. It's just actually say relax, relax, and relax. And it's interesting how just the words, because we hold a lot of tension in our jaws and our shoulders. And if we just go relax, 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 we actually feel relaxed. Then E is for express. Express how you're feeling, non-judgmentally. Express, because it's much easier to keep the energetic throat, which is your thyroid gland, open so that you can talk about it. Because often when we don't, that energy goes somewhere. If you've got pain, usually to the place of pain. Then the A is affirm. Affirm your wonderfulness. Affirm that you can do what you're going to set out to do. Don't set out with the negativity. Start with I can. Then T is touch. I think touch is really important. Maybe just touching a tree, touching some soft fabric, touching something that gives you pleasure, touching a person, provided you're careful with the COVID situation. And H is heal. Visualize your body can heal. Our minds are incredibly powerful, and we used to believe that our mind was this way and that's it. But with neuroplasticity and all the research, we can influence the way we think. So we can hardwire the brain. So it's good to hardwire with positive, not negative. And E is energy. So if you visualize energy entering in from the top of your head and just allowing the energy to fill you completely, and let it be universal life force energy, whatever you connect with, nature, the divine, a tree, your cat, whatever it is, just visualize that beautiful energy filling you. And you're so full and it's surrounding you. So you move in your beautiful bubble of loving energy. So those are kind of things I think one can do on a very quick thing to keep oneself centered and recognize your own worth. So it's BREATHE.
Beautiful. Beautiful. Could you go over them again? So the first one is breathe.
Breathe. The second one is relax. The third one is express.
Yes.
The fourth one is affirm. T is touch. H is heal.
Oh, so beautiful.
And the last E is energy.
Mm. Thank you so much. I had a poem that I wanted to, poem prayer I wanted to close with. Is there anything else that's on your heart that you would like to share before we read the poem?
I just want to say what a privilege it is to know you, and thank you for what you do. I so appreciate it. Thank you.
Thank you. Thank you so much for being a bridge, and what a gift. I'm so honored. It's a holy privilege to work with you. Thank you, Louise. Thank you for doing this. I'm
Thank you for asking.
It's like she said yes. And so this is by Rabbi Rami M. Shapiro. And I think it speaks to what we were talking about in our conversation today. So it says, there are moments when wellness escapes us, moments when pain and suffering are not dim possibilities, but all too agonizing realities. At such moments, we must open ourselves to healing. Much we can do for ourselves, and what we can do, we must do. Healing, no less than illness, is participatory. But even when we do all that we can do, there is often still much left to be done. And so we turn as well to our healers, seeking their skill to aid in our struggle for wellness. But even when they do all they can do, there is often still much left to be done. And so we turn to life, the vast power of being that animates the universe, as the ocean animates the wave, as the ocean animates the wave, seeking to let go of that which blocks our healing. May those whose lives are gripped in the pain of suffering open even now to the wonder of life. May they let go of the hurt and meet the true self beyond pain, the uncarved block that is our joyous unity with holiness. May they discover through pain and torment the strength to live with grace and humor. May they discover through doubt and anguish the strength to live with dignity through suffering and fear, the strength to move toward healing.
Wow, it's beautiful. Beautiful.
Reminds me of you and your beautiful work and the many things you taught me the other day. So,
Thank you.
Rami Shapiro. Thank you so much, Louise. And
Thank you. Thank you.
such a gift to be with you this evening. Thank you for your wonderful